Hello and welcome. Today I'm going to show you how to strap an MCL, in other words your medial collateral ligament of your knee. The MCL is responsible for medial stability of your knee, and where you may have strained it in an injury, we want to use this colorful stretchy K-tape to help support it and facilitate the other muscles around your knee to provide stability while you're rehabilitating your knee. If you're wondering how to apply the taping, please go and look at one of our previous videos which just explains the basics about tape application, simple concepts such as trimming the corners off the edges to help it to stick better, how to clean the skin before you put the taping on, and how to use adhesive sprays that just help the tape to stick a little bit better. To strap the MCL, you want to be able to get a length measurement. So you're going to get the patient with their leg forward and you're going to measure from the top of their tibia bone just below their knee up to about mid-thigh area. You're going to cut the tape at that point, and then you're going to cut a longitudinal strip, leaving about a 10 centimeter, 15 centimeter strip, and make sure that you cut all the corners off the tape to make sure it sticks properly. Then you're going to tear a few different bases, one that's going to go above the tibia, one that's going to go along the MCL, and then your two bases at the other end. So you're going to start with the patient's leg just in this position, placing the base of the tape at an angle. Just rub it down to get it to stick. Then you're going to ask the patient to lift their foot up to a 90-degree knee flexion angle. Take the second layer off, and you're going to use your hand to internally rotate their tibia. So grip the tibia, twist it inwards, and stretch and pull the tape at a bit of an angle. Rub it down there, make sure there are no creases. You can see there's a little bit of tension on the tape in that area. And then you want to use these two strips to facilitate the quad muscles above their knee. Just make sure you give it a good rub to make sure it's sticking, and place the bases down with no tension. So you have nice tension along your MCL and facilitation, helping your quads to work a little bit better to stabilize your knee during your MCL injury. If you enjoyed this video, please don't forget to hit the like button and consider subscribing to our channel. You'll find lots of other strapping videos just like this one for different injuries and conditions. You can see some of the links that I've attached here. Please go and have a look at them. We're going to be continuing this series for another 10 or so videos, and I would love for you to join me.